Well, first of all, I got into this because I would see guys come to the office that had tried other treatment modalities, whether it was fillers or fat transfers or suspensory ligament ligations
Oh, I saw
or
that one. Yeah.
placing a silicone implant, and just some of these guys were having total disasters. I mean, that's not
Yeah.
to say everyone that has these procedures ends up with a total disaster, but even if it's 5 or 10%, that's just way too much. I mean, I remember this one patient I had, this 25-year-old male nurse who like had a pretty normal sized penis, good looking guy. And he had had what's called a pneuma implant. It got
Oh,
infected. He was in
oh,
the hospital for a week with antibiotics, had it taken out, had needed two additional surgeries to try to fix all the scar tissue. And still, I mean, he's lost about an inch and a half in length, and he's sort
uh,
of permanently emotionally scarred from that whole process. And so, do you really want to take that risk? Or there's another kind of famous study of, not study, but a case of this like billionaire who had a fat
remember that.
transfer and ended up with a fat embolism and actually died.
I remember hearing about that on Joe Rogan's podcast and looked into that. Yeah, and I was like,
Like,
what's
so
going
I
on,
mean, do you want to have
man?
people go back to your like 20th high school reunion and like, oh, did you hear what happened to Joe? Like,
I would
do you
really
really
want
want to be
that.
that guy
No.
that died from a fat embolism from a
Oh,
penis
jeez.
enhancement procedure? So, I mean,
No.
that's the beautiful thing about the P-Long is it's totally 100% safe. I mean, it's traction, it's suction, it's the Affirm nitric oxide boosting supplement, and it's a PRP injection. So, once a month for 6 months. And so basically, we take your blood, we spin the blood, we get rid of the red cells, we get rid of some of the plasma, we take the activated platelets and re-inject it back into the penis. The way I do it,
Mhm.
using ultrasound guidance, I actually only make one little injection site with a 30 gauge needle. Drawing the blood from the arm typically hurts more than the injection in the penis.
Well, I mean, it's kind of like rest assured. I think it's a little bit safer to go that route than, ending up with a whole bunch of different. Because I remember looking into the suspensory ligament, and I thought, I guess back in the day, like 5, 10 years ago, it seemed like that was the only surgery that really existed. I'd seen some other things out of Korea as well, where they were using like the fat fillers as well. And I'm just like, well, that doesn't really look like they got it just right. I don't know if you listen to George Carlin at all, but he had this joke
Yeah.
about breast implants. He's like, well, if I were you, I'd wait 20 years down the road because right now they look all kinds of fucked up. It's kind of true. You're right. Now they've kind of mastered it to the point where it's just something common, right? And I think what you've done too is revolutionize our perception, or I guess the way that we look at male enhancement now, because it's kind of like, well, it's safe, it's effective, and one of the major keys that you mentioned there as well is that the functionality side of it is still there, and it's actually working better, which I think with a lot of those other surgeries, I mean, I don't want to end up on botched.
Yeah, definitely not. But the other thing is, and I'm sort of projecting from the female perspective. A lot of women are interested in sort of guys' self-confidence.
Yeah.
And if you come into the bedroom with a big piece of silicone in your penis or a bunch of fillers in your penis, like even though it might make your penis a little bit bigger, it makes your stature and your sort of ego a little bit smaller. And I think women are looking for that sort of stature and ego as much as the size of the penis. And so, um, if you can do something like the P-long, which
Hmm.
increases length, girth, and function, but you have a totally natural, normal appearing penis, it's just bigger and better. I think that plays more into the self-confidence factor than getting something synthetic or artificial put in there.
Yeah, and I mean the thing about having something synthetic put in there is that you never know how your body's going to react to it. And I think it kind of looks weird too, because that I've seen some of it and it almost looks like the vascularity's gone. It kind of looks like a big, smooth, like dildo-ish type dick, where I'm just like, that looks kind of odd. It doesn't really look like it belongs to you. It's almost like something foreign inside of the body
Yeah.
is now there. It almost looks like a plastic, I don't know, contraption's been added to your dick, which I think is kind of just odd looking, right?
Yeah.
But there was one thing I wanted to ask you about the P-Long study. I wanted to know about one of your favorite clients that kind of went in there, got the P-Long, what his initial, like how did his whole situation just kind of come about with, like, let's say his wife, and how everything changed after the study? Because I'd be really interested into like that side of things. I always like hearing the anecdotes, man.
Yeah, I mean, guys just have like a better outlook on physical intimacy. You know, they're more confident going into the bedroom, and that I think reflects with their partners as well.
Hmm.
Um, so, you know, and I think the functionality also is an important part of it. So there, you know, when you look at PRP, there have been, I think, 4 studies on the benefits of PRP. 2 of the studies looked with 3 injections. One study looked at 2 injections, and those were positive outcomes. And then one study out of the University of Miami looked at, I think, either 2 or 3 injections, and the what's called the SHIM score, which is
Okay.
a measure of, it's a questionnaire that measures erectile function, went up 3 points in the injection group, but it also went up 3 points in the placebo group. And so their conclusion was, well, it didn't work. But they never really explained why it went up in the placebo group. And so I think across the board, studies that look at the use of PRP in the penis have shown some benefit. But, you know, we're doing it once a month for 6 months.
Yeah. Yeah, and I think, well, the P shot's something that's being used more and more. And it's not just, I mean, I first heard about it for a guy who was actually treating his hair loss, which I found kind of interesting. I'm like, and
Mhm.
then during the conversation I had with you, you're like, well, no, the P shot's actually, I'm using it for the penis. I'm like, wait, hold on, there's more to this science, and it feels like it just needs to be explored more to be fully understood.
Right. Well, it's just, you know, it's platelets, and platelets have 2 functions in the body. One function is to cause a clot, but the other function is to trigger regrowth. So anywhere in your body that you need a clot, there's the assumption that there's some sort of damage.
Hmm.
And so you know, the good Lord created this amazing system where you deliver clotting factors, but then you also deliver growth factors to help that tissue heal and regrow. And so we're just taking advantage of the fact that there's a massive amount of growth factors in platelets and then just delivering it into the penis. Now, you could also deliver it into hair follicles. You can
Yeah.
also deliver it into joints, and a lot of orthopedists use PRP to help stimulate the growth of collagen and elastin. You know, a lot of dentists use it to help with gum growth. A lot of wound healing doctors use it to
Interesting.
help wound healing. So it's, you know, it's a very non-specific group of growth factors that is autologous, meaning it's from you, right? So you're
Interesting.
not getting it from somebody's placenta, you're not getting it from a cell line, you're not getting it from any other source except from your own body.
Interesting. Well, that way the body doesn't reject it. Back to your point about
Exactly.
functionality, right? It's kind of like, well, no, this came from me. Therefore, I know that it's mine and it's not something I'm going to reject. The other question I had too in regards to the P-Long study, did you use Gaines wave technology along with the P shots, or?
No, you know, when you're doing a study like this, you want to limit the number of variables.
Okay.
And so, you know, I thought about it. I mean, I thought about using low intensity shockwave therapy and a number of other treatment modalities. But at the end of the day, you want to see what actually kind of works. And so I think the combination of traction and suction helps pull the penis in length, pull the penis in girth. The nitric oxide boosting supplement improves circulation in general and helps with nighttime erections. And I can talk to you about a really cool study I'm doing now on that.
Yeah.
And then the PRP kind of makes it go faster because it's introducing growth factors. And the other cool thing is, you know, the study was 6 months, but I have patients who participated in the study and then continued on month 7, month 8, month 9, month 10, and they're continuing to get growth. So, you know, 15% at 6 months is kind of average.
Hmm.
But if a
Wow.
guy is interested in 25%, it just means that they have to continue doing it.
Yeah, I think everybody is. As soon as you see 50%, I wouldn't want to stop. I'm like, let's see if we get to 50%. But yeah,
Well, you know,
tell them.
I had one patient who stopped, and I asked him, I was like, you know, how come you're stopping? He's like, well, My wife says I'm too big for anal and I'm too big for oral. And you know what? I got to keep at least one orifice open.